ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੀ ਮਾਰ ਪੈਣ ਦੇ ਸ਼ੁਰੂਆਤੀ ਦੌਰ ਦੇ ਵਿੱਚ ਸਭ ਤੋਂ ਜ਼ਿਆਦਾ ਕੇਸਿਸ ਸਾਹਮਣੇ ਆਏ ਸਨ। ਇਸ ਤੋਂ ਬਾਅਦ ਕਈ ਮੌਤਾਂ ਵੀ ਹੋਈਆਂ ਸਨ। ਪੂਰੇ ਹਾਲਾਤ ਨੂੰ ਕਾਬੂ ਕਰਨ ਵਾਸਤੇ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਕੀ ਕਾਰਵਾਈ ਕਰ ਰਿਹਾ? ਮੌਜੂਦਾ ਸਥਿਤੀ ਦੇ ਬਾਰੇ ਪ੍ਰੀਮੀਅਰ ਜੌਨ ਹੌਰਗਨ ਨੇ ਟੋਰਾਂਟੋ 'ਚ ਸਾਡੀ ਸਹਿਯੋਗੀ ਜਸਲੀਨ ਕੌਰ ਨੂੰ ਫੋਨ ਲਾਈਨ ਦੇ ਉੱਤੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ।
Premier John Horgan, very warm welcome to PTC Punjabi. Thank you so much for your time. My question to you is that BC's top medical health officer, Dr. Bonnie Henry, said that the curve in BC appears to be flattening, which is very encouraging. But if in case the numbers increase, does BC have enough medical supply?
Well, certainly we're very encouraged by the curve that we've seen, a decline in the growth in the number of cases of COVID-19 in British Columbia. We've seen a decline in the number of citizens that are in hospital, a decline in the number of citizens that are in intensive care. But unfortunately, we've seen another 4 people have passed away. So 4 families are now mourning the loss of a loved one. So we have to keep focused on making sure that we do what Dr. Henry has asked us to do. We need to stay 2 meters away from people. If we can stay home, we should stay home. We need to wash our hands and avoid touching our face at all times. On the question of personal protective equipment, we've been working tirelessly by ourselves here in BC, but also with the federal government to make sure that we're getting enough supplies either from outside sources or finding new and innovative ways to get that supply up to a standard that we need it at. And Dr. Henry and Minister Adrian Dix have been working very, very closely to make sure that our health authorities, whether it be Fraser Health, Coastal Health, or here on the Island Health, or in the north and in the interior, that they have the equipment that they need for those frontline workers. In addition to that, of course, we want to make sure that ambulance paramedics, firefighters, and other responders, police, who may find themselves attending circumstances that would have people that are ill, we want to make sure they have equipment as well. So we're trying to prioritize getting that equipment out. But as the report I had earlier in the week is that we have enough for now, but it's going to be a challenge. Everyone in the world is trying to find this equipment to protect their healthcare workers, and we're not alone in that effort. We were the first province to release our modeling, and that's why we're so excited with the results, the success we've seen. The point of having a model is to make sure that we have enough space in our healthcare system that there was a crush of new cases. And that meant we had to make the difficult decision to cancel elective surgeries. Many people, and when they're called elective, but if it's relieving pain, whether it be a hip or a knee replacement or some other elective surgery, those individuals are struggling and their quality of life has been diminished. But in order to provide the space in our acute care system, we had to cancel those procedures. But we announced all of this 2 weeks ago, Friday. We were the first province to do so.
My next question to you is that on April 14, BC will mark the 4th year anniversary of the declaration of the overdose crisis as a public health emergency. Vancouver recorded 8 suspected overdose deaths in 1 week in March, the highest weekly toll since August 2019. And the increase in overdose death is a reminder that the city is now experiencing 2 public health emergencies. So one is COVID-19 and the second one is overdose crisis.
I absolutely agree with you. And my Minister of Mental Health and Addictions, Judy Darcy, is working very, very closely with public health officials, with first responders, whether they be firefighters or ambulance paramedics, to make sure that they have the tools they need to protect themselves, firstly from COVID-19, but also to ensure that they have the resources to bring people back, whether it be naloxone kits, which are very useful in that regard, or any other health equipment that they require to do their work. But we in British Columbia have two epidemics going on concurrently. And in vulnerable populations, like, for example, the downtown east side, homeless people, whether they be in Surrey or Victoria or Prince George, they are susceptible to COVID-19 just as they are afflicted with addictions. So we're trying our best to address both of these issues at the same time.
Premier Horgan, how the government is making sure that the drug users keep a safe distance in an effort to reduce the spread of COVID-19?
This is an ongoing challenge. This is not generally a population that spends a lot of time watching television or hearing from Dr. Bonnie Henry. They don't access the internet to get useful information. So we've relied on what we call peer helpers. These are people who are oftentimes volunteers in working with vulnerable populations, the homeless and the marginal, to make sure that they have an understanding that it's important that they keep a distance from other British Columbians. And it is an ongoing challenge. We have to talk directly to people because they're not getting information from the radio or from television or from the internet. They get it from people that they trust and count on. And that's oftentimes their caseworkers if they're involved with the social development ministry, or it's volunteers who have been potentially addicted in their past, and they give back to the community by being there with clear minds to try and help those that are struggling with addictions. But it is a challenge, and it's one that Dr. Henry reminds us of daily. We need to redouble our efforts to make sure that we're speaking directly to those vulnerable populations and let them know that they have another risk in their lives if they need it anymore, and that risk is COVID-19.
Absolutely. Thank you so much, Premier Horgan, for joining in and sharing all this information. Thank you and stay healthy.
You too.